HIV and HPV are both sexually transmitted viruses, but they differ greatly in how they affect the body. While both can be passed through intimate contact, their impact and the way they interact with our systems are quite distinct. HIV attacks the immune system, specifically targeting cells that help the body fight off infections. Without treatment, HIV can progress to AIDS, a condition where the immune system becomes severely weakened, making even minor illnesses dangerous. It's a lifelong infection if untreated, but with modern medicine, people living with HIV can lead long, healthy lives. HPV, on the other hand, infects the skin and mucous membranes. It often causes warts, but certain high-risk types can lead to cancers, such as cervical, anal, or throat cancer. Most HPV infections, however, go unnoticed and clear up on their own without causing any health problems. Nearly everyone will get HPV at some point in their lives, but most people's immune systems clear it naturally. In contrast, HIV is less common and without treatment, persists in the body for life. The difference in prevalence and persistence is important to understand. Prevention also differs. HPV can be prevented with a safe and effective vaccine, ideally given before exposure. For HIV, prevention relies on consistent condom use, taking PrEP medication for those at higher risk, and practicing safer sex. Each virus requires its own prevention strategy. HIV requires daily lifelong medication to keep the virus under control. There's no cure yet, but treatment is highly effective. HPV has no cure either, but its health effects, like warts or precancerous lesions, can be treated or managed by healthcare providers. Misconceptions often blur the lines. HPV is not a form of HIV, and having one doesn't mean you have the other. It's important to separate fact from fiction to make informed decisions about your health. It's possible to have both viruses at the same time, and having an STI like HPV can increase your risk of getting HIV if there are open sores or lesions. This makes regular screening and open conversations with healthcare providers essential. Understanding these differences is crucial for accurate risk assessment, making informed choices, and reducing the stigma that surrounds both viruses. Education empowers us to protect ourselves and others. HIV is a systemic immune disease, affecting the whole body, while HPV is a localized cellular infection, usually limited to specific tissues. Recognizing this distinction helps guide prevention and treatment. Clear knowledge helps us prevent, test, and treat both viruses effectively. Regular checkups, honest conversations, and staying informed are key steps. Don't let myths shape your understanding. Facts empower better choices, healthier lives, and a more supportive community for everyone. Prevention is your strongest shield against HIV. Consistent and correct condom use during sex is highly effective. PrEP, a daily medication, offers powerful protection for those at higher risk. Regular HIV testing is essential. Knowing your status helps you take action, whether to stay negative or start treatment. Modern antiretroviral therapy can suppress HIV to undetectable levels, making it untransmittable. Never share needles or injection equipment. Use sterile supplies every time. Syringe services programs provide safe equipment and connect people to health services. These strategies save lives and reduce harm in the community. Take charge. Prevention and testing are key.